Now let's get back to your breaking news headlines. You know, they say that all publicity is good publicity, but when it comes to public health, that may not always be true. Recently, there has been a surge in monkeypox cases in many countries. As of May this year, more than 200 cases have been reported from more than 20 countries. India has also reported some cases. And now there is panic. Now, first things first, do not panic. Monkeypox is not a new disease. It was first discovered in monkeys, hence the name. In 1932, it is caused by a virus, the monkeypox virus. And like I said, this is not a new virus. It belongs to the Orthopoxvirus genus in the family Pox. The other members of this family include varicella virus, which causes and vaccinia virus, which causes smallpox. Smallpox, by the way, was eradicated in 1979. Now, unlike smallpox, monkeypox is not highly contagious. You cannot catch it through casual contact or by being in the same room as an infected person. Close contact is required for transmission. So, how is monkeypox transmitted? Through direct contact with the infected person, or with the infected animal, or with material from an infected person or animal. It can also be transmitted through respiratory. The incubation period is 6 to 13 days, but it can range from 5 to 21 days. Symptoms include fever, headache, muscle aches, fatigue, swollen lymph nodes, rash, which later turns into sores or blisters. And these sores later turn into scabs and then they fall off. So, the symptoms are very similar to smallpox. Now, since monkeypox is not a new virus, we already have a test to detect it, and the test can be conducted in most of the labs that test for infectious diseases. The case fatality ratio, or CFR, varies between 0.5 and 1%. Most people recover with supportive care. There is no specific treatment available, but we do have a vaccine. It's called It was developed against smallpox, but it protects against monkeypox too. The vaccine is 85% effective if administered within 4 days of exposure. After 4 days, its effectiveness reduces. So coming back to the current outbreak, it is spreading fast, but so far the number of cases is small. The World Health Organization says the risk of further international spread remains low for the general population. At the same time, they say they are closely monitoring the situation. The U.S. health authorities are on alert. They're saying they expect more cases to be reported. But here's the good news. They say they're not expecting a large outbreak because of the immunity available due to vaccination. See, smallpox was a terrible disease. It killed millions of people in the last century. To protect people from smallpox, a global vaccination campaign was launched in the 1960s. Some countries, including the United States, routinely vaccinated their citizens till 1972. So there is a section of the population which has some immunity left that should help curb the spread of monkeypox. Having said that, all countries have been asked to remain vigilant. India, for example, has a well-developed surveillance system for infectious diseases. In fact, India was declared polio-free in 2014. The country has also eradicated smallpox and eliminated diseases like measles and rubella. So India is prepared to deal with monkeypox. In fact, India has already detected and isolated some cases. The question is, what should you do if you feel unwell after coming to India? Well, immediately isolate yourself and contact the nearest health facility. Do not panic, but do take the necessary precautions. I'll tell you what the experts are saying. Monkeypox may not be as deadly as COVID, but it could prove to be equally disruptive. And that's something we should brace for. And that's 1 minute. See you tomorrow.